Hi everyone, my name is Haley Mann and I will be presenting on the disparities in healthcare between the deaf and hard of hearing community. Throughout this slideshow, I will cover the main issues surrounding the deaf and hard of hearing and healthcare, the resources to support the individuals when they are presented with issues, and services to help them gain access to qualified interpreters. These are just a few questions you will be able to answer at the end. The first one is, for Arizona residents, what are the 2 resources to find an interpreter for the deaf? Question number 2, what adverse health outcomes can arise from the language barrier presented for the deaf and hard of hearing? Question number 3, what website can you go to fill out a form if your healthcare provider is unable to communicate effectively with you or you have questions? The major disparity is a language barrier. Results of that consist of less frequent visits to their primary care providers, more trips to the emergency room, increased risk for cardiovascular health, cancers, pregnancy and birth, high blood pressure, and diabetes. Here's a video from ISU Division of Health Services.
A cross-sectional audit study was conducted to determine if patients who can hear are more likely to secure new patient primary care or dental appointments than deaf patients who use American Sign Language. During this study, simulated deaf patients and simulated patients who can hear were given identical lists of primary care and dental offices and were instructed to call to establish new patient appointments. The study found that deaf patients were nearly 2 times more likely than hearing patients to be denied an initial healthcare appointment. The findings suggest that requests for appointments failed most often because deaf patients requested sign language interpreters. This accommodation would have been necessary for effective communication during these appointments.
The Americans with Disability Act is a civil rights law that prohibits any discrimination based on disability. Regarding health care, it requires medical care providers to provide full and equal access to individuals with disabilities. In May of 2016, Catalina Devandes Aguilera hosted an expert group meeting in Geneva, Switzerland for the rights of persons with disabilities. The meeting focused on the rights of persons with disabilities to the highest attainable standard of physical and mental health. Hasir, a doctor from National Technical Institute of the Deaf at Rochester Institute of Technology, stressed that not only deaf patients require access at healthcare settings, but deaf parents and family members as well. He highlighted several cases where deaf individuals had been denied access to interacting with medical professions who are treating their immediate family members. The National Association of the Deaf was created to ensure and provide accessibility to language services and health information for deaf and hard of hearing individuals. The NAD is a great resource for deaf individuals to go to when their medical care provider is not providing them effective communication or services. It is also available for the individual if they just have a question. If you just visit www.nad.org/contact-NAD/, it is a website to access the form to fill out if you have any questions or comments about your healthcare providers. You are also able to record a video of yourself signing to communicate as well.
Anne Greenall is undergoing an asthma screening, interacting with a respiratory therapist despite the fact she can't hear a thing. She doesn't have to. A translator is bridging the gap.
I'm able to communicate effectively with hearing people.
The Americans with Disabilities Act requires hospitals to provide effective communication for the hearing impaired in all healthcare settings. It doesn't mandate a method, but computers can't compete.
Of course, there's a lot of technologies out there, but you cannot eliminate the face-to-face.
So you haven't had to use that?
No, I haven't used it.
It sets the patient at ease, and it sets the patient care provider at ease, because Lee Memorial Patient Care Team really wants to make sure that the patient leaves fully understanding their care.
Communication being a two-way street, the translating works both ways, giving health information to the patient, but also getting feedback in return. In that way, doctors and health professionals can hear the patient's questions and concerns.
We consider all the people that we work with are deaf consumers. So not only when we come into a situation, hearing people are also people that we're interpreting for.
Anne is all smiles at the end of her appointment. A potentially stressful situation is translated to a pleasant experience. For Lee Memorial Health System, I'm Amy Osher.
Next one. Big deep breath in.
Arizona Freelance Services offers interpreting for the deaf and hard of hearing. The services they offer consist of medical care, mental health, law, and K-8 education.
Welcome to the website for Arizona Freelance Interpreting Services. ASLIS provides professional interpreting services using nationally certified and state licensed interpreters. The services we provide include on-site ASL interpreting, certified deaf interpreting, on-site and remote computer-assisted real-time captioning, also known as CART, video remote interpreting, also known as VRI, as well as legal interpreting, oral interpreting, and tactile interpreting. Due to the recent COVID pandemic, we have also added a new service called ASL Video Production. Using this service, we can add ASL to any video or written document as an overlay. We provide services in many different situations, such as medical, legal, educational, and a wide variety of other community settings. If you would like to learn more about any of the services we provide, click on the Services tab at the top of our website, or feel free to contact us by phone at 480-595-9515, by video phone at 480-525-7821, or by email at scheduling@azflis.com. You can also use the chat right here on our website. Thanks so much for visiting, and we hope you have a great day.
Arizona Commission for the Deaf and Hard of Hearing is a state agency that also provides interpreting services. On their website, you are able to search for an interpreter through their directory. I provided a screenshot from their page. All you do is click on Interpreters, search Directory, select your location, and a list of licensed interpreters, and their information will appear on your screen. Here are a few links to the resources that I provided throughout the slideshow. I hope that you all find them useful, and thank you all for watching my presentation.